we want to know these things is so that when people present to us with problems for treatment, they're going to have difficulty with certain movements or conducting ranges of motion through certain areas. And it's in our interests and their interests to know what are all the factors and what are all the things that can cause this to not perform like it's supposed to. Basically what we're looking for, what are the relationships? And the more accurate you can be in finding the relationships of where dysfunction is stemming from, then the greater potential you have in what? Providing an appropriate treatment. You know, the knee pain that really was from the pelvis. The frozen shoulder that you just told me about, she just told me about it. She had a lady, a frozen shoulder, had been and done all these different things and it wasn't working. She evaluated her and started treatment from the pelvis because that's where the greatest thing that seemed to be a problem was. And lo and behold, after starting with the pelvis and working her way up, some knee things that had been a problem got better. The shoulder then eventually got better, and then she progressed it into doing like Spencer's technique and things like that, which were not possible initially. But had she not started at the underlying place of where it was really stemming from, the success or the chances of success are what? Much slower, much less. Okay? Question would be, I would think, well, why are you looking at my pelvis? It's a shoulder thing. Oh, because when is a shoulder thing not a shoulder thing? When it comes from somewhere else. And the pelvic injury occurred when she was many years prior, right? She had an injury as a child or something. So this is the way we're talking about it. And then people look at you like, that's amazing, how did you know to look there? Well, it's just because that's the way you think. That's the way you look at things. That's what we're shooting for. Now, it's not to say that every problem is a pelvis problem, right? But it gives the idea in the illustration that, you know, a problem with the shoulder might be a problem with the shoulder, or it might be a problem somewhere else, oftentimes central to that area. Okay, so things to think about.